A proven and reliable database is crucial in the implementation of regulations in tobacco harm reduction (THR) in Africa. THR experts and advocates, including those from Malawi, say the availability of such data can help the continent to effectively promote the regulations that are crucial in controlling diseases and other harms that go together with tobacco use. Kondwani Chinele has compiled this report, being read by Austin Kashbea.
Whilst the number of combustible tobacco smokers is dwindling in developed countries, the numbers of active smokers is increasing in Africa and other developing nations. World Health Organization's statistics show that 80 million people die from tobacco use annually. Of these people, nearly 80% are from middle and low-income countries like Malawi. Due to the projected increase in youthful smokers, the region is expected to face a heavier burden of tobacco-related illnesses, non-communicable diseases, and deaths in the future. During the 2024 Harm Reduction Exchange held in Nairobi, Kenya, Chimwemwe Ngoma, a THR advocate from Malawi, said for the guidelines to work, there's a need for countries in Africa to have a reliable science research database.
The absence of data or the limited data available on the topic is a hindrance to the production or the coming up of regulation in the African continent. So this can easily be addressed by putting into place deliberate measures where big organizations, including the WHO and other public health organizations that are concerned about tobacco use and smoking, to come up with deliberate measures where we can develop independent data that can be used by the regulators to come up with the regulation.
Amos Leon is a young Kenyan who quit smoking and is now a harm reduction advocate. Leon said as Africa pushes for the promotion of THR, there's a need to include the youth in the implementation.
Nicotine pouches are being produced for young adults, not young people, but young adults. And this is a conversation that we should not shy from, because it happens in reality. And these youth are being exposed to them. This generation has transitioned from the older one. Now they are using social media. So we should integrate the youth into social media, do advertisements, and really be clear on these products, and because there are benefits and there's also harmful. So we don't need to shy away from the conversation that it has both sides.
This year's conference was held under the theme Enabling Innovation in Harm Reduction through Science-Led Regulation and Policy Making.
And that's it from our newsroom this afternoon. A recap of our top stories before we leave.